Earlier this year, I experienced some severe abdominal pain. Wanting to avoid a copay, I waited a couple weeks to see if it would subside, and when it didn't, I went to the doctor, with my only real worry being my health, as I do have health insurance. So, to my surprise, a couple weeks later, I received a bill for $600 stating that I was out of network. $600 is a large sum, especially to a college student, but to a lot of Americans, that's nothing compared to what they pay for their health insurance. But, in fact, 60% of bankruptcies in the U.S. are attributed to healthcare debt, while 3/4 of those people had health insurance. And further, it's shown that patients who worry about the cost of care have far worse health outcomes. America is the only large, rich country in the world without some form of publicly funded health care to its citizens. There's extensive evidence that proves that universal health care would ensure a healthier, happier, and more productive society. The U.S. spends more on healthcare than any other country in the world, and the next biggest spender doesn't even come close to us. While this graphic is a little bit outdated, in 2015, it does show the differences in costs. As of January 2018, the U.S. was now spending over $10,000 per capita or per person on healthcare, nearly 20% of our total GDP. Yet 26 million Americans are still without insurance. This cost is greater than the entire GDP of France or the United Kingdom, yet both of these nations have far better health outcomes than we do, and every single person has coverage and equal access to care. As you can see, Britain spends around $4,000 per capita. People often argue that this must mean we have better care, better facilities, and more physician visits, but once again we fall behind. In fact, you can see by this graphic that Americans see a doctor about 4 times a year, while the Japanese see a doctor about 12.9 times per year. When looking at acute care hospital beds, you can see that we have about 2.5 per 1,000 population, while the Japanese have 7.9. These figures parallel health outcomes too, particularly when you examine life expectancy. While the U.S. spends more than any other country, we have one of the lowest life expectancies of any OECD country. We're at the bottom with 79.3 years, while Japan's at the top with 84 years. The average physician visits are a huge indicator of differences in health. How many of you avoid going to the doctor until you're too sick to avoid costly copays, high premiums, high deductibles, and out-of-pocket costs, or avoid going at all and hope for the best? I know I have. When cost is a factor, it can have a huge influence. Because of this, we tend to, as a society, have more of a focus on treatment rather than prevention, even though there's a lot of evidence showing the economic incentives for prevention. In fact, increasing use of preventative services, such as tobacco cessation screening, to 90% of the recommended levels could save $3.7 billion annually in medical costs. However, prevention often requires regular checkups to monitor health. And cost is one of the biggest arguments against universal health care. It is true that it would require higher taxation, but that would ultimately lead to greater savings for not only the individual, but also for the government as a whole. Governments that provide health care universally, though, are spending significantly less than we are on health and have greater productivity as a result. Often people cite the Affordable Care Act, otherwise known as Obamacare, as a reason why universal health care would not work in the United States. Obamacare did have good intentions and good results. It allowed children to stay on their parents' plan until the age of 26. It expanded Medicare or Medicaid, and it prevented insurance companies from denying care to patients with pre-existing conditions. Additionally, nearly 30 million Americans received coverage thanks to it. Originally, it was meant to provide care to all while driving down costs as a whole. Still, many people chose to pay the penalty rather than pay for insurance because it was cheaper in the short term. This is partially because lobbyists backed by insurance companies would not allow the bill to pass in Congress unless these companies were still making plenty of profit. So the insurance premiums are very high. In short, Obama had to make a lot of concessions for the Affordable Care Act to pass, making it less effective and ultimately a failure in many ways. Obviously, the issue of healthcare in our country is an incredibly complex and highly debated issue, and there's much more to consider than what I've mentioned. Ultimately, it's become a bipartisan issue in an individualistic society, and there are some that believe that health is a privilege and not a right. Regardless of your opinion on this, I hope that this has made you consider the issues that exist in our healthcare system, because when examining the data, it's undeniable that something has got to change.